Hello, SG here from the Rehab Hub. So I'm on. Earlier, I put out a video about can Pilates help with multiple sclerosis, MS, and this video follows on from that on how you would get started if you have MS, what we recommend, and if you're an existing client with us, how you link into a more specific program with us here at the Rehab Hub. So in terms of what happens, I'm in the clinic room here in our Kinning Park facility. And what we recommend is that we put you through our 3D movement analysis. And what this does is these cameras behind me here are infrared. The company that we work with, this is a spin-out company from Oxford University, and it's the gold standard for movement analysis. Now, the reason that we encourage this for our patients, our clients with multiple sclerosis, is purely so that we can see where they're at. We want to see how the nervous system being affected by MS is affecting their ambulation, how they're moving and walking, because many of us with MS, it's mobility, that's the biggest fear, loss of function. So monitoring that and actually looking at where strengths and weaknesses are. As part of that 3D movement analysis, you also get a full musculoskeletal assessment. What that involves and what that means is that we actually test the muscles. We actually see where your strength is, where your flexibility is, where you may be having tightness or spasms in the muscles. So we get this very objective data, and we recommend that you have that done every 6 months. If you have MS, and we monitor this and we make sure that what we're giving you in here is appropriate for keeping you strong, keeping you supple, keeping you moving, keeping you healthy, all of what we're wanting. So in terms of that assessment, it will include also a posture assessment. So you get your full movement, musculoskeletal, and also a posture assessment as well. Full case history taken, and really then from there, we're then able to help you in your sessions with us. So what I mean by that is if you're coming and you're using Pilates is our rehab method of choice here. And if you're utilising that and wanting to keep your body moving, and it's a fantastic method, but it's so easy to just go through the motions with things and not do things properly or not be trained or taught properly. It's important that what we give you is specific to what your requirements are. And this really is where the analysis and the assessment comes in, because if we come at that with an informed perspective, then we're there in a position to then best advise you. Whereas if we're just taking you into a general class and just making you do general stuff, that may not be the best fit for you. It may not be the right exercise for you. Generally, patients with MS, fatigue is a big issue. Big long classes, big energy classes may not be where you need to be. But also you tend to maybe get particular aches and pains, you might get flare-ups, and it's important we take all that into consideration. So the assessment is an important aspect and a big important part of that. One, for monitoring, and two, for that in-depth knowledge of us getting to know you, and you know exactly what you're doing and why you're doing it. So I hope that makes sense. So the first thing that you would start with would be the clinical Pilates. So you would essentially, with this video, there will be a link to the appropriate page where you would book this. So you would come in, you'd be assessed. That assessment lasts about an hour and a half, so it's a thorough assessment. You would get a full report of findings on that, and that would all be explained to you, and you would also receive something digital that you can keep that would be explaining exactly where your results are. Those results are stored on our big Oxford University system. So all that data that's there is kept. And the great thing about that is in 6 weeks' time, when we're reviewing that data, we can do comparisons based on the original data and the new data. So it really means that we're getting a true indication of where you're at, and we can pick up things very quickly if there's something not quite right. So we're able to then feed that back into your particular consultant or wherever you're needing to go. So we're able to then send that on to wherever it needs to be, or further investigation, or are you having a relapse? We're monitoring that with you. But hopefully what we see is that actually there's improvement, that that would be an ideal situation where we can actually say, you're doing a lot better, you've got more mobility there, you've got more strength there, you're walking better, you've got more balance. So these are hopefully the types of results that we do start to see. But the key there is the regular monitoring, because without those patterns, without getting that regular monitoring, you've got nothing to base that off. And sometimes when we lose our mobility, when things start to go away from us, it doesn't just happen. You don't generally wake up with it one night, go to your bed and you're fine, and then you wake up the next morning and you're not. It's insidious. it happens over a period of time. So, slowly things are taken away from you. So our job is to keep a close eye on that and to make sure that we're keeping things going. A big part of some of the things that would be appropriate for some of the MS clients is that we want to be looking at working through that neuromuscular connection as much as we can, reducing stress, bringing breath work into it, working through the cerebellum, so that refined motor movement. So as part of that rehabilitation, it's important that you one, know what you're doing while you're doing it, and that we're giving you the correct type of rehab based on what you're needing. Many of our patients have problems with mobility. They're getting pain, maybe loss of sensation or altered sensation or loss of power. All of these, I'm sure if you've got MS, you can relate to this: chronic fatigue, depression, feeling just hopeless. All of that's part of this process, and having a mapped out plan and monitoring and support through keeping you active and healthy through a long and healthy life. We welcome to be part of that journey with you and help you along in that journey. Getting started, if you've never been to us before, book the clinical Pilates. The link will be with this video. That is definitely your protocol. It will come with that full assessment, everything that I mentioned, and it will also come with 2 one-to-one sessions. And those one-to-one sessions will be taking you through your Pilates movement, what you need, utilising and using the reformer, using the tower, using appropriate equipment for you, depending on your needs at that specific point. But it will equip you ideally to get into small group classes or larger group classes, or a combination of both. Again, that is very unique to each individual. Many of our patients with MS are fine to go into general population classes. They're absolutely fine. But some days where they're just not feeling it. Sometimes the smaller group, those kind of clinical Pilates sessions are where they want to be more focused, maybe working more on mobility that day, maybe working more on coordinated movement, whatever it may be for that particular person. But that's your starting point. But please rest assured that we will always give you the best advice. We will always be open and honest with you, and we will always direct you to the appropriate rehabilitation or class based on your requirements and your needs. I hope that makes sense. If you have any further questions on this, or you're really concerned, please don't hesitate to reach out to us, whether you reach out via the online form, or whether you just give us a call. Our phone number, you'll go through to our lovely girls down at the call centre, and they will pass anything on, and we can give you a wee call back if that works for you. Or if you're just ready to get started and booked, you can just quite literally click that link, and it will allow you to book, and you'll be sent straight to the diary where you would just book in for your gait and posture assessments. And pretty much we can usually get these, see you usually within a few days. You're not usually waiting long to get done. So if you're keen to get started, if you're looking for something, even with Christmas and things coming up, this might be something that you might want to think about. If you know somebody that's maybe needs a bit of help with their MS, as much as they might not have the motivation, right, because the chronic fatigue that you get with this, or many patients get with this, can be absolutely debilitating. But speak to them, or get them to come in. Generally, the types of, once they've been in and they see the support and the encouragement that they get, it's a very welcoming, encouraging, and relaxed environment in here. And generally, most of our patients feel really, really good afterwards. There's other things that we can do in here to help with that, but that's for another video. But this is terms of getting started with Pilates. Please don't hesitate to reach out and get yourself booked in, and we'll see you soon.